Question 9, Camilla Belich.
Thank you, Mr Speaker. My question is to the Minister for the Public Service. Does she stand by her statement that serving the public must always be our top priority? If so, have the government's public sector cuts affected essential frontline public service roles?
Mr Speaker.
The Honourable Louise Upston.
To the first part of the question, yes. To the second part, no.
Supplementary. Does she agree with the 86% of surveyed healthcare workers who believe that the government's cuts will make it harder for people to access healthcare? If not, why not?
Mr Speaker, in terms of the government's focus, we have very deliberately focused on frontline services, reduced bureaucracy and the need for backroom staff, and I'm pleased to see in the area of health an increase in the number of doctors and nurses.
Can she guarantee that Kāinga Ora will provide the same level of service to the public, given a third of their workforce has been cut within a single year?
Mr Speaker, on behalf of the Minister, our government has been very clear about the fact that there is a need to get government spending under control. Any decisions that are made about reductions in staff and where those roles are from come from the Chief Executive. But at the end of the day, for every worker, it is about getting on top of the cost of living, which means reducing excessive government spending and focusing the staff in the public service on the front line and improving outcomes for New Zealanders.
How can frontline workers prioritise serving the public in their frontline roles when the Minister has demanded and is forcing frontline workers to perform, as the Minister has demanded, when the government is forcing frontline workers to perform administrative tasks, for example, in health?
Mr Speaker, on behalf of the Minister, our government has been very clear about the fact that we are focused on improving frontline service delivery, whether in health, whether in education, whether in law and order. Individual decisions that are made about staffing levels and changes are made by Chief Executives, but we do not shy away from the fact that we are absolutely focused on reducing excessive government spending to get on top of the cost of living crisis, and every worker, public sector or private sector, are affected equally by that.
What steps will she take as Minister to support the remaining public sector workers, given that over half of public sector workers report having, quote, too much work to do everything well following the government's cuts?
Well, Mr Speaker, I'm not sure where that member gets her information from, but the public service are very clear about why they come to work every day. That's to serve the New Zealand public, and government targets in areas in health, education, welfare reform and keeping people safe on our streets is exactly what they come to work to do.